Good afternoon, ladies and gentlemen. Thank you for giving me an opportunity to share the experience from India on the challenges faced by persons with disabilities in accessing primary healthcare service, and also the importance of community mobilization towards achieving the equity in health. Now, first let me share few lines about CBM. CBM is a leading disability development organization working in India since 1967 for improving the quality of life of people with disabilities by promoting inclusion and comprehensive healthcare, access to education, and creating livelihood opportunities. As we all know that health is important in itself because it enables a person to have a full life expectancy, and persons with disabilities have the same health needs as every other members of the population. They may also have an additional or more complex health needs because of their impairment and the consequence of the impairment. Now, though equitable access to healthcare service is a major principle of national health system, but people with disabilities are facing a greater barriers in accessing the healthcare service. Now, when we are talking about the physical barrier, immediately that strikes to our mind is the absence of ramp, but it is also the other facilities. For example, a woman or girl with disabilities hesitate to visit the health centers because of the absence of accessible washrooms, and also because of the absence of the accessible furnitures or equipments. In most cases, people with disabilities are not being examined with the same standards. When it comes to information and communication barrier, which is less recognized and understood by many people, people with the hearing impaired face huge difficulties in communicating because there are no sign language interpreters available in the health centers. And also the people with visually impairment face a huge problem in reading the instruction given by the doctors. Now, the negative attitudes of the healthcare provider is also an important barrier for people with disabilities, and this discourages people from attending for healthcare service. And these problems are further exacerbated for those with disabilities from certain ethnic minority groups. Now, poor access to healthcare service and rehabilitation may impair the person from enjoying the other rights because disability, poverty, and poor health are interrelated. People who are poor are more likely to gain disability. After the onset of the disability, they have less access to healthcare service and therefore experience unmet healthcare needs, possibly resulting in poverty. Now, let me share an example of Mr. Santosh, who had an infection in his leg, and because of his economic limitation, he was unable to afford to visit the health center, which was 40 kilometers away from his village, and finally end up losing his leg. And because of his disability, he lost his job and got trapped in the cycle of poverty and social exclusion. Now, because of deficiency in the healthcare service, people with disabilities are more vulnerable to other health complications. For example, the child in the image having a severe disability is highly vulnerable to the secondary condition like pressure sore and at the high risk of premature death. Now, because of this higher vulnerability, people with disabilities need access to healthcare service more than others. So, we should ensure the service are made available as closer as possible for people with disabilities to have easy access, and also the health facilities should be made accessible for all, which also implies the right to seek, receive, and impart health related information in an accessible format. Now, health professionals should accept people with disabilities and treat with respect and dignity. They should also support them to make decisions for themselves on the basis of informed consent, and also should make the services affordable and provide equally to all the individuals irrespective of their gender, age, and ethnicity, and also to provide with the same quality as to others. Now, access to healthcare for persons with disability is a complex issue, hence for promoting equality and equity within this context. Actually, it requires a range of responses. It is important that both to enhance the capacity of people with disabilities and their families to access the healthcare service, and also to ensure that the system and the procedures accommodate people with disabilities and is also able to respond in appropriate and timely manner to their needs. For example, conducting a community general health care checkups to proactively identify health needs that may have been unmet, and also to have a strong referral systems for accessing the appropriate rehabilitation needs. Let me share an example how CBM has been promoting inclusive healthcare services through the community-based inclusive development approach. Now, this approach involves various stakeholders to address the health inequality, especially empowering people with disabilities along with their families and community to take collective action to build resilient, equitable, and inclusive community. Now, community mobilization is an important backbone of this approach, where people with disabilities, their families, and community were mobilized to analyze and address the barriers they are facing to access healthcare service by taking an active participation in planning, implementing, and monitoring of the healthcare service. increasing community awareness regarding disability, importance of health, needs of persons with disabilities, and the rights, which not only reduce the stigma against the people with disabilities, but also brought change in the health seeking behaviors. And knowing their rights, people with disabilities along with their communities are demanding for inclusive primary health care. Now, training for healthcare professionals, especially the frontline health workers who work very closely with the community, are trained on the rights of persons with disabilities as reduce the stigma and improving their communication skills to interact with people with different disabilities, have strengthened their relationship with the people with disabilities, and ultimately improved in delivering a quality health service. And this approach not only ensured that people with disabilities to access healthcare service, but also the healthcare service to become inclusive and reach the whole population. People with disabilities and their communities are taking proactive measures so that nobody is actively or passively discriminated against. We cannot achieve the equity of health without the active participation of people with disabilities and the communities in the local health program that includes from the time of designing the program. And community mobilization is an important because it will enable people to exercise collectively their responsibility to their own health and demand for the quality health service. So, making healthcare service inclusive, respectful, and barrier free will help people with disabilities to realize their other rights to education, employment, and so will improve their well being, social inclusion, and reduce poverty. Taking the tagline of CBM, together we can do more, let us join our hands together to achieve the health equity for all. Thank you very much.